Welcome to Thriving with ADHD, a podcast where we'll share everyday practical tips to thrive in life as an adult with ADHD. This podcast is brought to you by Animo Sano Psychiatry, a behavioral health practice with a specialist ADHD clinic based in North Carolina. And this is your host, Nada Pupovac. Welcome to the fourth episode of Thriving with ADHD, dear ADHD community. Today we are talking about cognitive behavioral therapy and ADHD. We have a pleasure to welcome back our amazing PA, Maddison Henley. And before we start with the episode, I would like to mention that our fast-growing team is hiring for multiple positions, including psychiatrists, PAs, nurse practitioners, and mental health therapists. If you or someone you know are a behavioral health professional and would like to join our innovative and passionate team, please visit animosanopsychiatry.com/careers and get in touch with our team. That's animosanopsychiatry.com/careers. Thank you. Welcome back, Maddison. I'm so happy to have you again on the podcast. And today we are talking about very important thing, and that's cognitive behavioral therapy in ADHD treatment. As our listeners probably know, ADHD is a condition that's treated both with medication and non-medical types of treatments. And cognitive behavioral therapy is definitely one of the powerful tools in the management of the condition. So, as there might be people who are not familiar with this modality and what it can do, could you just please explain to us what's cognitive behavioral therapy?
Yeah, sure.
Mhm.
And yeah, thanks for having me back. But
No
so
problem.
getting into it, cognitive behavioral therapy is a form of psychotherapy that we offer. It
Mhm.
focuses on kind of the connection between our thoughts and emotions and our behaviors.
Mhm.
It works to identify unhealthy or negative thinking patterns and beliefs, and then replacing those with healthier, more productive ones. It also encourages patients to kind of monitor those behaviors in order to maybe recognize triggers that are impacting their mental health.
Mhm.
Um, Through CBT, the hope is that people can gain control over their thoughts and feelings and kind of lead a more happier life from there.
Mhm.
Some of the common practices in CBT involve setting personal goals, developing individualized plans for reaching those goals. Our therapists can help with challenging irrational thoughts and modifying unwanted behaviors,
Mhm.
also working with patients to kind of practice cognitive tools like problem solving, self control,
Mhm.
mindfulness techniques that all in turn help to reduce stress levels and improve emotional regulation.
Mhm.
Some of the other common CBT strategies include learning different coping strategies, relaxation techniques, like I said, recognizing maybe triggering things that lead to those maladaptive behaviors, and then
Mhm.
practicing new thought patterns to try to replace those negative ones.
Thank you. And maybe we can try to dig deeper, and maybe you can let us know what are the benefits of cognitive behavioral therapy in ADHD management specifically.
Yeah, so CBT can be really helpful for people with ADHD.
Mm-hmm.
It can help to modify behaviors and reduce some of those symptoms like impulsiveness, distractibility,
Mm-hmm.
hyperactivity, a lot of times trouble with organizing tasks or managing tasks. Also, kind of developing strategies to navigate through challenging situations more effectively and
Mm-hmm.
overcoming some of those stress-inducing emotions or um, habits that people get into.
Mm-hmm.
It can also encourage patients to take responsibility for some of their actions by kind of learning how to set clear goals for themselves
Mm-hmm.
and learning some of those tools through therapy, like problem solving, self control techniques, mindfulness techniques. Individuals with ADHD can learn better ways of managing their behaviors, and ultimately, the benefit would be kind of improved focus, improved organizational skills, improvement in time management skills,
Mhm.
and overall kind of an increased motivation level, and better emotional control.
Mhm. Um, and could you now maybe let us know about a few real life examples for a person with ADHD that cognitive behavioral therapy can help with? So we talked about the benefits in general, but for our listeners to maybe imagine some real life example how cognitive behavioral therapy can impact our thoughts, feelings, or behaviors.
Yeah,
Yeah, that would be great.
yeah,
Thank you.
sure.
Yeah.
Um, so so with CBT, in relation to ADHD,
Mm-hmm.
there's a lot of kind of specific areas that it can really hone in on in relation to ADHD.
Mm-hmm.
One of the common things that we see with a lot of our patients with ADHD is that they have a lot of irrational beliefs about themselves, or even kind
Mm-hmm.
of the world around them, or just kind of feeling like they're not good enough due to the executive dysfunction that they're facing.
Mm-hmm.
And so CBT can help with challenging those irrational thoughts, and then kind of using cognitive restructuring to help patients not only identify their abilities, but also changing the way that they view themselves, especially in settings like work and school, where their performance or their tasks are constantly being assessed by other people, whether that's like teachers or bosses, things like that.
Mm-hmm.
And so that's really important because I mean, having constant unhealthy thoughts or negative thoughts about yourself can make it really difficult to work towards the goals that you have set out, and to be productive in daily tasks.
Mm-hmm.
That also comes into play when, with ADHD, we see that sometimes patients feel like every little thing has to be perfect or else it isn't good enough, or maybe they
Okay.
feel that they can't do anything correctly when they aren't meeting those goals. So CBT really helps to change those thought patterns so that patients have an increased self-esteem, and ultimately able to accomplish more things. Um, Another area is helping with modifying behaviors, such as becoming less impulsive, or at least identifying maybe the areas where impulsivity is problematic, or maybe
Mm-hmm.
causing challenges, like maybe spending too much money, or unhealthy eating choices, or so
Oh,
on and so
okay.
forth, in relation to impulsivity. Um, Another area is managing distractions better.
Mm-hmm.
So a lot of times we see that prioritization is a big problem area or struggle that a lot of people face, and kind of learning organizational techniques that are specific to what's going to work for that patient
Mm-hmm.
is really helpful in maybe identifying areas or times when procrastination is at its worst, and learning how to kind of work up that motivation, or find the motivation during those times to get the tasks that you need to get done. In addition to that, it can also help with kind of implementing strategies for just better time management in general,
Mm-hmm.
which can really help with daily functioning, whether that's in the workplace, or even at home with everything that you have to get done in your personal life as well.
Mm-hmm.
Um, CBT also really encourages individuals to recognize triggers, and implement strategies that allow them to manage their symptoms more effectively, in ways like setting really clear and precise goals, and then identifying maybe rewards for once you meet those goals.
Mm-hmm.
And that can be really helpful for just seeing the progress that you're making, and helping the patient to better process maybe new experiences that they're going through, or coping with maybe goals that they didn't meet, or deadlines that they missed, and kind of how to succeed through those things. And even when you're not meeting your goals, just having that person to kind of talk that through with, is really helpful for a lot of people. Um, Another area is problem solving. So
Mm-hmm.
tools for problem solving and learning that self-control that really helps with emotional regulation. So we see a lot of times that emotional dysregulation is very common in individuals with ADHD,
Mm-hmm.
as well as just comorbid mood disorders like anxiety and depression. And so CBT can help to manage the stress that comes along with that, in addition
Mm-hmm.
to ADHD. So um, seeing that relation to their executive dysfunction and helping to motivate the patient to have healthy lifestyle choices like diet, exercise, healthy sleep hygiene, like we talked about last time.
Yeah.
Um, and if nothing else, the therapist can just spend that one-on-one time with the individual to help them maybe just better understand ADHD in general and kind of educate them on the symptoms and maybe I know a lot of my patients who are in therapy right now, they say that just being in that setting where they kind of have that one-on-one time to talk through their symptoms and understand like, hey, this is why I do things this way, and
Mm-hmm.
that's why this didn't work out for me is because maybe I was doing it wrong or I didn't have the proper tools in place, and just having that time is really helpful, and it really makes patients feel validated kind of in the symptoms that they are experiencing because
Mm-hmm.
they know that number one, they're not alone. And then just knowing that kind of that is the reason why they're doing things the way that they are. And that it's not something that's wrong with them or so on and so forth.
Yeah.
And then just having kind of that neutral third party to talk to as well, I think is really helpful, and it's a really valuable tool to have for patients with ADHD, but also with any mental health disorder
Oh
as
yeah.
well.
Yeah, it sounds very powerful, and
Yeah,
and I'd say we really encourage our patients to um, try a comprehensive and well-rounded approach. So not just medication, but everything else that can help to improve the situation, to manage condition, and really have more fulfilling life. Really, that's all what
yeah, for
this is
sure.
about. Um, so if anyone wants to start with cognitive behavioral therapy, what's the best way to go about it?
Yeah, so um, the best way to go about finding somebody who does cognitive behavioral therapy
Mm-hmm.
is finding a qualified specialist or therapist that maybe specializes even in the treatment of ADHD if that is
Mm-hmm.
something
Mm-hmm. Mm-hmm.
that you're wanting something more specific towards, but also obviously CBT is very helpful in other mental health
Oh yeah,
disorders as well.
absolutely.
We have therapists here that specialize in our clinic with
Mm-hmm.
ADHD, obviously,
Mm-hmm.
but also well equipped for other areas. But
Mm-hmm.
if patients aren't local, one of the resources that I give to patients is Psychology Today is a really good online resource where you can like type in your zip code and find therapists that are local, but
Mm-hmm.
also kind of filtering out by what they specialize in, maybe what insurance they take, if they offer in-person or virtual visits. So it's a really helpful resource. And then you can also read kind of a little bit about each therapist and find one that's a really good personality fit for you. Because I think it's really important
Oh yeah.
for patients to have a therapist that they're comfortable with. And I tell patients that too. If you meet with a therapist and it doesn't seem like a good fit, it's not going to hurt their feelings because you guys are both going to get the best improvement, and it's going to be the best benefit for you if you're comfortable with them. So sometimes it takes like a little bit of looking around, but
Mm-hmm.
finding that good fit personality wise is important too. And then once you have found someone that works well with you, you guys can kind of work together to set personal goals and develop an individualized plan for maybe the schedule that you're going to meet on and things like that. So it's really individualized, but there's a lot of resources out there online that help kind of search for therapists locally.
Thank you so much for sharing that. I think this is very important and valuable for our listeners, and hopefully it will help them in find the right match for them. So thank
Yeah.
you again. Um, and just like all other episodes, the way we would like to finish this one is If there is one most important thing that our listeners could remember from this episode, what that would be?
Yeah, so
Mm-hmm.
I think that CBT is a really valuable tool,
Mm-hmm.
especially for patients with ADHD,
Mm-hmm.
ADHD. And while CBT doesn't replace the value of medication management, I do think that it does help to add strategies and changes to areas that medication can't.
Mm-hmm.
So for example, while medications might help someone to focus, it's still not choosing what you're focusing on.
Correct.
So
Yeah.
therapy comes into play by helping you better prioritize your tasks and your to-do list and kind of close that gap to help further provide kind of symptom management. Ultimately, there's going to be areas that patients still struggle with regardless of medication. And this is really where the value of therapy comes into play. And to help further provide symptom relief. I think patients really do truly see the best result with that combination of therapy and medication. And I think the beauty of CBT is that it can be so personalized and individualized to someone's individual needs. And just having that person there and those tools in your toolbox to help you during both your highs and your lows, I think is really important. Something that anyone would benefit from whether or not you have ADHD. So yeah, I think CBT is very important and worth a shot.
Thank you so much. I enjoyed this conversation and we learned a lot today. And I'd say we encourage people to just do the best for themselves and try to get help. And this is definitely one of the very powerful tools that can help in this process. Thank you so much. And hopefully, we'll see you again soon.
Yeah, thank you.
Thank you for listening to Thriving with ADHD. This show is produced by Animo Sano Psychiatry. Please follow, rate, or share our podcast on Spotify, Apple Podcasts, or any other streaming app of your choice. Music is by Daddy's Music from Pixabay. For more information about Animo Sano Psychiatry, please visit animosanopsychiatry.com.